Get this, people are putting children on daycare wait lists before they're even pregnant. That's how tough it is to find quality care in Wisconsin, and that was before the pandemic. Now the problem is getting worse and fast. Fox 6 investigator Amanda St. Hilaire shows us how.
Good morning.
Having a child is forever watching your heart run around outside your body.
Mommy, I'm gonna hug and a kiss.
One more hug and kiss?
Yeah, over here.
That's just fine. Love you.
That's why it's such a big decision to send those little hearts through someone else's doors. Doors you can't even get past anymore.
Staff and children are allowed inside the building, but nobody else.
Bye.
Thanks to COVID-19. Through all the changes,
Perfect.
the kids are all right, but the people taking care of them are not. Child care providers in Milwaukee County and nearly 100 miles away near Madison tell the same story.
I'm really worried about the stability of the industry.
Can we do this forever? Probably not.
Child care advocates and state leaders agree. If something doesn't change, licensed quality child care will become even more unaffordable and unavailable as providers close their doors. We could blame COVID-19 and end the story right here. But the Fox 6 investigators discovered this problem started more than a decade before the pandemic. In 2010, Wisconsin had nearly 9,000 licensed childcare providers. Over the next 10 years, that number almost cut in half.
Providers can't meet their bottom line, and parents can't afford it.
Wait a minute. If you're paying for licensed childcare, chances are you're crying at least a little bit every time you write that check. An infant spot can cost more than in-state college tuition. So you might be wondering, how are providers not raking in a bunch of money? Turns out, a lot of that money goes back into keeping up with state regulations, like having enough staff for child-to-teacher ratio requirements. Then there's rent, utilities, cleaning, insurance. In a class of 18 children, providers say typically only numbers 16, 17, and 18 bring in profit, if they're lucky. So that expensive check you're writing is not expensive enough for the provider to have anything but razor-thin profit margins.
It's a backbone industry to Wisconsin's economy.
That's why Wisconsin's Department of Children and Families got grants to work on making childcare more affordable and available.
So we were feeling really good going into March.
But then, well, you know what happens next.
Illness and deaths from the coronavirus pandemic rise in the United States.
Here in Wisconsin, the number of coronavirus cases continues to grow.
Coronavirus cases skyrocketing.
Growing numbers of outbreaks of coronavirus across the Badger State.
Coronavirus tightening its grip throughout the country.
More cases than any other country in the world.
This was just the most devastating thing that we've ever experienced.
Overnight, we went from full with waiting lists at both centers to about 30 kiddos at each center.
Most providers temporarily closed. Parents scrambled.
We were home for 11 weeks. I worked from home and stayed home with the kids. We had an in-home care person that came for half the day so Dad could try to get some work done. And we made it work. Mom's in healthcare, so she's an essential worker and had to be working.
Most eventually reopened. But as of mid-September, state data shows 10%. That's roughly 400 childcare providers were still not open. And it's not exactly happily ever after for the ones that are.
We're lucky to break even.
We thankfully had a savings account that we're using and relying on.
Some parents decided to keep their kids home. But these providers say they also need to deliberately keep their capacities low.
Are you having a good morning?
To prevent the spread of COVID-19.
Perfect.
Remember that class of 18? Cheryl Peters' center is half full. Forget profit, her revenue is down 40%. Even though she's raised tuition. Maria Fitzgibbon is also below capacity, yet turning parents away.
It feels bad, especially when they call and they're panicked about needing something, immediately or in the next couple weeks, and I don't foresee anything opening up.
Of the providers that are open, state data shows 39% had 0 available slots for any age. 59% had 0 open slots for children younger than 2. Wisconsin Early Childhood Association estimates by the end of summer, the state had lost 50,000, nearly 30% of its childcare slots. And providers say if they don't get help soon, parents will have even fewer options.
Because for them to be able to go to work and help and be there for others, they need us.
So what now? Roughly 80 million CARES Act dollars already went to Wisconsin childcare. But that 80 million only covered roughly 14 weeks of expenses. It's been 28 since providers had to change the way they operate.
If there was an end, we could say, oh, we could, have this X amount of dollars and we could make it through, but not knowing, it's just a struggle.
Pushes to bring in more federal dollars are stalled in Congress, leaving any reimagining of childcare funding to the states.
Do I think it will happen in this budget? No, I do not.
Wisconsin Early Childhood Association is pushing for the next budget to set aside $60 million a year for childcare stabilization, plus an expansion in subsidies. While state lawmakers fight that out at the Capitol.
Perfect. High five.
Childcare providers say they'll fight to stay open.
Mommy, bye-bye.
So on your way to work,
Bye, buddy. Squeeze. Go ahead.
you can feel safe
You guys are doing an amazing job.
as you watch your heart walk through those doors.
Come on.
Amanda St. Hilaire, Fox 6 News.
Amanda couldn't find any state lawmakers who would say Wisconsin's childcare landscape is in good shape, but there will likely be a back and forth over how much that area should get in the next budget. Wisconsin isn't alone. This is an issue all over the country, so we'll keep you informed of any developments.
The coronavirus continues to